So Saurabh, you let me know when we go live on YouTube, yeah?
We are going live now, sir. It takes 6% so.
Okay. Okay, so this is 11:30 and time to start. So thank you very much for joining in. My name is Ravi Mahajan, and I am the Director for Critical Care Integration and Transformation at Apollo Hospitals Group. And it's my pleasant duty today to navigate you through to the program this morning. So just to start the program, may I invite our President of Apollo Hospitals Enterprise Limited, Dr. Hari Prasad, to give his welcome address. Dr. Hari Prasad.
Thank you, Professor. Respected Chairman, Vice Chairperson, Ms. Preeta Reddy, Managing Director, Ms. Sangeeta Reddy, Sunita Reddy, lifesavers, I mean the intensivists from the Apollo system, from India and internationally, personnel from the media, ladies and gentlemen, good morning, and it's my proud privilege to welcome you to this special event. Apollo hospitals and critical care are literally synonymous. Ever since the first hospital was started almost 40 years ago, Apollo hospitals was trusted for the critical care it provided. Globally, as a percentage, 10 to 15% of the beds of the hospital are normally allocated to critical care. But with the vision of our chairman, right from day one, more than 30% of the beds in every single hospital of the Apollo Hospitals group were allocated for critical care. And the hospitals were so designed that these could be expanded at any point of time. And the pandemic demonstrated Apollo Hospitals' capability in terms of providing world-class critical care on a large scale. During the pandemic, especially the second wave, the number of critical care beds were literally doubled. And the thousands of patients who benefited from the services of our intensivists and our multidisciplinary teams is worth mentioning here today. India is a huge geographical expanse with islands of excellence in an ocean of inadequacy. There are plenty of brilliant hospitals with wonderful intensive care units, mainly concentrated in the metros, where a large part of India, where a majority of the population lives, is grossly underserved in terms of critical care. The number of qualified intensivists in this country is less than a tenth of what this country requires. There are no intensivists who will be able to provide adequate care across even 10% of the country. So we need to do, when our chairman, with his vision of reaching out to every single individual in the country, started what is known as the EICU, which is the electronic platform using technology. An intensivist sitting anywhere in the world could actually treat and take care of a patient anywhere else in the world. Right now, we have about 1,000 patients whom are intensivists. You can see Dr. Sai Harinath sitting there. Behind him is the control room of the cockpit of the EICU, from where he's actually monitoring over 1,000 patients across the country, from the most rural, most inaccessible areas, starting from Himachal to the mountains of the Himalayas to everywhere in the country, and providing access to quality critical care. Now, this is the beginning of a much bigger journey, and we are very happy that Professor Ravi Mahajan has joined us. He was the president of the British Society for Emergency Medicine of Anesthesiology. Correct me if I'm wrong, Professor Mahajan. And then he just joined us, and he's taken over the responsibility of standardizing and making sure that critical care in this part of the world is comparable to the best in the world. And it not only follows benchmarks, but creates benchmarks for the rest of the world. As of today, apart from the 1,000 non-Apollo patients who are being monitored by this team, we have another 4,000 patients who are within our system in the critical care. And we have the largest ECMO. Today, we have about 45 patients on the ECMO in the Apollo system. So we are now expanding these services, improving these services, embracing technology, and making sure that every single patient who needs critical care gets the best of critical care. And one last thing I wanted to say about the specialty of critical care at Apollo is the availability of multidisciplinary care. Critical care is not about a single physician or an intensivist providing care. It is about different specialties coming together for that particular individual and providing support and providing care, because majority of these patients tend to go into multi-organ failure and need expertise and skill to manage more than one organ in a critical situation. So I think the multidisciplinary care will not only be limited to the physical patients present in the hospital, but will be extended beyond the physical confines of an intensive care in the Apollo hospital onto the electronic platform using technology, using the eICU. So once again, ladies and gentlemen, welcome to this special event, and thank you for being here. Over to Professor Mahajan.
Thank you very much, Dr. Hariprasad, for such a brilliant introduction and start to the program. So as Dr. Hariprasad mentioned, the Apollo hospitals and critical care go hand in hand, and that remains one of the strongest points of the Apollo network. So why do we need this center of excellence that we are launching today? So if I can take you through what has already been said, 80% of the physicians in India work in urban areas, while 70% of the population resides in remote areas. So there is that challenge, hence there is work to do. And the work to do is to provide smart solutions to the national shortage of experts, also to standardize, as Dr. Hariprasad quite eloquently mentioned, to standardize critical care throughout Apollo network and beyond, to partner with and add value to non-Apollo units, both public and private. And it's important that we are, or the Apollo are embracing the public as much as the private units for partnerships, and so that we have win-win-win for the patients, non-Apollo units, and the Apollo networks. So with those aims in mind, when we are looking for excellence and pursuing excellence and continuing to pursue excellence in critical care, this is what the center has determined to do in days and months and years to come. First is to oversee expansion of hubs and spokes network of Apollo units and non-Apollo units all over the country and beyond. We've got very successful model working in Hyderabad. We want to extend it. And as we speak, we are working in Madurai and Chennai, and that should be, those centers or hubs should be coming along very, very soon. And then we will be expanding even further to the rest of the country. The second thing, of course, is that once you've got spokes and you've got hubs, you've got to support your spokes, and you've got to support those partners not just by providing the critical care to their patients, but also to upskill them or the upskill people there and upscale the scope of the units. The standards of care Dr. Hariprasad mentioned, very, very important. So the center will see to it that we have protocols and SOPs in place. And I have good news to give you that we've already got a live website today for the Center of Excellence in Critical Care. And that has list of protocols and SOPs already available. The list is expanding day by day. We have partnered, of course, with Medversity, with Apollo Knowledge Series and Apollo Telehealth to provide the education to our spokes units, but also ongoing education to our own people in critical care. And this is a multidisciplinary and multi-professional educational platforms that we've got. Whether you are a doctor or a nurse or a paramedical healthcare employee, you will find something of use there. There's a rolling program that this center will be putting forward and will be conducting. Of course, nothing can improve without proper research and without proper quality indicators and measurement of quality indicators and quality improvement programs. So that is another big thing that we'll be doing. And for all this, we are seeking international collaborations. We already have people who've expressed a lot of interest in many of these areas, whether it's to expand the network or to define standards of care or participation in education or research. It will be great to expand internationally. As Dr. Hariprasad already mentioned, I think the figures tell me, or my research tells me, that Apollo network of critical care beds would put Apollo at the top in the world in terms of critical care provision entity in the corporate sector. And that's my research. I may be wrong, but I think that is where we are. Therefore, we've got to consolidate that position and take it further in order to achieve our aims, which is providing international care, standard of care to every individual in India and beyond. Thank you very much for listening to me. And I think with that, setting the scene for the center and with the background that Dr. Hariprasad gave us, we are at right juncture to invite our Executive Vice Chairperson, Ms. Preetha Reddy. I can see her, she's joined us already. Ms. Reddy is such an ardent supporter for all the things that we do. And in particular, our vision for the critical care. And Ms. Reddy, if I could request you to please come in and let us have the overview or the vision of Apollo Hospitals in terms of critical care. Thank you very much.
Namaste. Our chairman, Dr. Mahajan, Hari, Dr. Sai, Professor Grocott, Dr. Allison. You know, it's just amazing to be among such wonderful clinicians. And I think maybe I'm the only non-doctor here again. So I wish I had been a doctor, but it has been incredible. The vision of our chairman, the fact, you know, what Hari said about what all it can do, and Dr. Mahajan on, you know, really putting the vision, taking it away from the drawing board and articulating it. I think it's amazing. The Apollo mission, actually, chairman articulated it almost 40 years ago. And it said that we will bring healthcare of international standards within the reach of every individual, and we are committed to education and research. The good thing about this mission statement and listening to all of you is that it is not within the reach of every individual in India, but it is for the region and really for the rest of the world. And when you all said international standards, I'm just listening to all of you, and I know there is a conviction in me that the international standards is going to be set by this team out of India, out of, the Apollo hospitals, and you will become a standard for the rest of the world to emulate. And to me, that is part of a strategic vision, that we as Indians, as very proud Indians, can really do something which the rest of the world will emulate. And I'll give you a simple example of what happened during COVID, that the district hospital in Chittoor, the outcomes were on par, if not better, than some of the global centers, because, we were monitoring real time what is happening in India, what is happening in the rest of the world, developed countries, underdeveloped nations. And we saw that the outcomes there were on par, if not better, because early intervention, protocols, which Dr. Hari, his red book, the team implemented there, close monitoring and access to the drugs at the right time, whichever were best in class. So I think all this came together to give a product which is away from the metros, in the districts, in the rural India, and we could do it. Same thing is happening with telehealth. So I think launching this today is, while we say that Apollo has 2,500 critical care beds, India has just 2.3 critical care beds for every 100,000 population, which is so not enough, not only for our country's needs. I think we will see transformative changes, which is happening. And today's announcement is definitely a game changer. We are committed to raising the 2,500 beds to 10,000 within the Apollo ecosystem. But with today's launch, I think we will be doing much more than 10,000. It'll be nice a year from today if we see the numbers which we can actually do. But to me, the sky is really not the limit. And the data which all of you are going to help us capture, utilize for the betterment of mankind, for the betterment of healthcare, I think that is going to be of great value. So tomorrow, when we say education and research, we are really bringing the vision, the mission statement into actuality, and we're going to be able to really deliver on that promise. And that again is excites me, and I'm sure that, I know Chairman so well, and once we say, Chairman, we are doing all this, he's going to be 10 steps ahead and say, but why not all that? So I will just say that, I really thank the team, Hari, Dr. Mahajan, Dr. Sai, that whatever Chairman wanted, this is his near-term goal, and I can see that. But if we achieve on the near-term goal, then the foundation will be set for the long-term agenda and vision. And I know that we will be able to deliver on that promise. Thank you all. I'm just so excited to be part of this great institution. And I'm sure that we will really make a difference in people's lives. Namaste and all the best.
Thank you very much indeed, Preetha, for such a wonderful support. We couldn't ask for any more. So brilliant. Thank you very much indeed for setting the scene up. I think we've, after the introduction by Dr. Hari Prasad and introduction to the center and the vision or the strategic vision for critical care by Ms. Preetha, the time is now right to invite Dr. Sai Haranath, who is Senior Critical Care Clinician in Hyderabad, for Sai to come in and demonstrate as to what does it really look like. I think to get that feel of something which is lively, and you've got live situation in front of you. Sai, all yours. Thank you.
Thank you, Dr. Ravi. Thank you, Chairman, for being the vision behind this. Dr. Hari Prasad, Ms. Preetha, thank you all so much for this opportunity to actually allow us to grow in this ecosystem, to really do what only one other country really does. Other than America, there is no other tele-ICU other than our large system. What you can see is a live telecast. So I'm sure our media friends know that in a live telecast, anything can happen. So we're actually in a live environment. We're monitoring patients around the country right now. You can see in the background one of my colleague doctors, Dr. Melito. Dr. Melito, you can say hello there to the screen there. And then we have our nurse also helping us with monitoring our patients. We are looking at centers around the country where we have critically ill patients who actually require assistance. Some of the assistance is simple, some of it is complex, but most of it is not available locally. What we have achieved through both direct advice as well as preventing transfers, which I will show you in a second in terms of the cases we have dealt with, is we have saved lives, but we have also saved livelihoods. When you assume a patient from a village goes to a city, along with him, his family, his teachers, as well as all of his the children, they all have to move. The boarding, lodging cost, everything goes up 7 to 10-fold. So just preventing one patient from not moving from their own home center is a huge economic advantage for them. The other things that we are actually looking at is in terms of, you can look at the background, that we're having several screens. We actually see multiple patients. I'm going to try to share my screen here and show you a quick snapshot, quick check for video. You'll be seeing a kind of a collage of multiple patients that we're seeing. Due to patient privacy, I'm not going to really show too many of that, but you can actually see plenty of the patients. I'm going to quickly run through a few cases so you can actually see what we're actually doing, and it'll be interesting for you to see the kind of patients that we have seen. Let me see if this works right here. This is actually our website. You can see that. I was mentioning that we have done some research. So just as a display here, you can see the articles that we have published. This is one which in our Apollo Medicine series. We also have another article about e-neurointensive care that we have published. And we also have an article in the Indian Journal of Critical Care Medicine. And what we are actually doing right now is that the patients that we have seen, the first patient is someone with a 32-year-old man with an acute stroke. And what he really did was this patient presented with what looked like weakness. He had fallen from a bike. But what our team did was to do the standard process of evaluating him. We, in fact, detected a stroke in a 32-year-old young man. We used tele-neurology advice, and we were able to actually guide the team at the remote site to treat the stroke and avoided a transfer. We had 24/7 availability of neurologists in our hospital, as well as subspecialists. And one of the biggest advantages, which is not seen in any other country, and I can say this with conviction because I do critical care for the US remotely, no other place can you get access to subspecialists 24/7. And we can do that in the Apollo system. Another patient that we saw was someone with a chest pain episode. And this patient, the ECG showed a very acute myocardial infarction, and cardiology is very dear to our chairman's heart, literally. And he would be pleased to know that we were able to diagnose the heart attack immediately. We had our cardiologist guide, and we were able to actually give thrombolysis to a patient located remotely. And once he stabilized, we transferred him for the advanced procedures, including catheterization. We are able to also rapidly recognize irregular heartbeats and things of that sort. Another patient we saw was a young man who in his village had a traumatic accident and he had multiple injuries. And we were able to guide the remote team because some of these patients cannot be shifted right away because they have multiple medical issues. And we were able to actually guide them in detecting lung collapse, detecting bleeding. And with the guidance of our trauma team here, we helped the patient actually stabilize till he could have definitive surgery. And lastly, I just want to share what is our war, the war we are all fighting now, the COVID pandemic. Fortunately, because of the vision, as well as, I really think it is critical to care, and that's what ICU is all about. Critical care is really caring. And our system was able to establish links with the help of our various verticals with very remote PSU hospitals so that they can get world-class care wherever they are. We have, in fact, a 45th edition of our protocols for managing COVID, and we were able to guide these remote sites. In fact, we have taken care of over 15,000 COVID patients remotely from this center over the last over a year and a half. So we are able to watch oxygen levels. We're able to teach patients to do something called awake proning, where you lay on your stomach and your oxygen level actually improves. So I'm going to stop with that right now, but I'm going to try to see if I can quickly screen share and show you one other thing, which I think you'll be very proud of. Let me see here. One second. So these are some of the articles our team has written. We are defining telecritical care for India. And I really cannot thank Chairman enough for pushing us in this direction. This is an article from the Indian Journal of Critical Care Medicine from the critical care team in Chennai. And they wrote this article during the COVID crisis. There's another article that myself and a colleague wrote about tele-intensive care in COVID. And with the help of some of our senior professors, including Dr. Ganapati, we evaluated our neurocritical care from Apollo Hospitals, Hyderabad, and we published this. There's a lot of data that needs to be published. And I'm sure you're all aware of the huge inroads artificial intelligence is making. And this is an area ripe for artificial intelligence. So to summarize, telecritical care is going to save lives. I must thank Chairman, I must thank Dr. Hari Prasad, and of course, Dr. Sangeeta Reddy, who's not able to be here today, but they have been the vision for us to kind of drive this forward as far as it has come. So we're going to try to share a video next, and I'm going to hand it back to Dr. Mahajan. And again, thank you so much for this opportunity to help us do what we do best.
Thank you, Dr. Sai Harnath. As you would have seen, such a brilliant example of what can be, is the art of possibility, what is possible and what can be achieved.
Yep. Okay.
And if we could summarize it all in the video, Saurabh, are we in a position to share that, please?
At Apollo Hospitals, we harness the power of technology to work for people at every level of our care network, to support both the caregivers and their patients, no matter where they are. With over 10,000 beds across 71 hospitals, Apollo Hospitals is India's largest integrated healthcare provider. And with approximately 2,500 critical care beds across India, we are the largest critical care providers in this part of the world. Apollo Hospitals have touched more than 150 million lives from 140 countries, with a mission to touch 1 billion lives. Bringing in the much-needed change required in providing quality critical care, and bridging the shortage of critical care beds, specialized doctors, and paramedical resources. Apollo Hospitals introduce modern and sophisticated critical care monitoring systems for anytime, anywhere care. Apollo eAccess. eAccess is our initiative to reach out to the remotest places to provide quality critical care services round the clock. This service is all set to usher in a new era of critical care management in the country. Our recent experience with COVID-19 surge strongly suggests that this is much needed in our country going forward. The eAccess initiative of Apollo Hospitals is a transformational, electronic critical care and emergency program that combines audio-visual technology, data visualization, predictive analytics, smart proactive alerts, and advanced reporting capabilities that are delivered by Apollo emergency and critical care experts. Apart from providing the much-needed critical care solutions, Apollo eAccess looks at the building competency of partner organizations by imparting evidence-based upskill programs. eAccess provides remote critical care monitoring service solutions to our partner organizations to equip them with trained intensivists round-the-clock, access to proven clinical protocols, and has the capability of connecting over 1,000 multi-specialty clinical teams of our hospitals. eAccess is a hub-and-spoke model. After the success of this model in Hyderabad Hub, we have begun an ambitious program of developing a network of hubs and spokes across India. We believe innovation is an attitude far from being merely skill, and at Apollo, we epitomize this truth. eAccess. Powered by technology. Empowered to save lives.
Thank you very much indeed for summarizing where we are with regards to, and our vision with regards to critical care networks and expansion within India and beyond. So this is, I think, the right juncture in the program to bring in our international guests today to see what they think, where we are, and how can we go further. So I'm very pleased to see Mike Swart has joined us. Mike, thank you for joining us. It's quite early morning for you in the UK. Mike is critical care specialist or consultant critical care in Torbay, but his main contribution to the UK medicine has been in form of as a council member of Royal College of Anaesthetists, but he has been a leading figure in getting it right first time, quality improvement program, and defining how can you get it right first time if you are a perioperative physician. And that is now a nationally rolling program, which is helping out people in the UK getting to grips with the backlog of the surgical care. So, Mike, here you are. Your comments, your reflections of what you've seen.
Thank you very much, Ravi, for inviting me to listen in and to contribute to this. It's very exciting. I'm not sure this is going to work, but I'll try. As I've been listening to this is what I'm seeing. I don't know if that worked, but it was the sun coming up. And this for me sounds like, or feels like, a new dawn of critical care. My initial thoughts, COVID-19 has exposed all of us to the inadequacies of our healthcare systems. Critical care sets a very high standard, but has very low access. What you're doing in India with Apollo, we need to replicate in the UK. We all need to improve training, to improve research, to work in a multidisciplinary way to provide better care or better access of care. This is very exciting. Thank you again for letting me join you.
Mike, with that accolade, thank you very much indeed. I'm sure, as you would have seen, there would be rooms for further collaborations on many fronts. This is only the beginning, but thank you for being here. I know it's early morning for you, and I know you're going to get ready and go to hospital. So if you feel like leaving at any stage, that will be fine, Mike. Thank you very much indeed. We have another guest, and she is from US, Dr. Kalpalatha Guntupalli. She could not be with us physically today, but she sent some warm messages, which Dr. Haranath is going to present. Dr. Haranath.
Sure. Hi, thanks. So Dr. Kalpalatha, as you all know, is a former president of the American College of Chest Physicians. She has led a critical care fellowship for almost 40 years. Several of her fellows are all over the US and the world, and she has a fond attachment to India, and every year she has been serving people. I spoke to her and she was extremely happy. She was, she's probably sleeping right now, but this is what she said. I'm very pleased to learn about the inauguration of the Apollo Center of Excellence in Critical Care. As a physician of Indian origin who migrated to the US in 1974 and has kept in regular touch with both systems of practice, I can emphatically say how important this initiative is. Practicing critical care is much like flying, managing a complex system that requires state-of-the-art equipment, methodical approach that is standardized and protocolized to maximize the return of health and minimize errors. This initiative of Apollo therefore comes at the most challenging time of the century, the COVID pandemic, having witnessed what can be the worst and best in medical care during this pandemic. I promise my fullest cooperation is needed to see this center excel. I have first-hand experience of the excellence in critical care provided at Apollo facilities when I took care of a patient for 3 weeks in 1999. I have much admiration for the vision of Dr. Pratap Reddy Garu and the leadership of Ms. Sangeeta Reddy. So I think she really wanted to join, and I'm sure this is honestly just the beginning. We have a long way to go, and there are multiple things that the world can help India, and we can help the world from Apollo.
Thank you very much, Sai, for presenting Dr. Guntupalli's, her comments and her good wishes. Again, we will look forward to collaborations. And now it's my pleasant duty to invite Dr. Alison Pittard. Dr. Alison Pittard is currently Dean of Faculty of Intensive Care Medicine in the UK, and this is faculty of 4 medical royal colleges. Dr. Alison Pittard is a clinician, of course, in critical care, and works in Leeds, not very far from where I started my career in the UK. But Dr. Alison Pittard has been so dedicated during the pandemic that Queen decided to award her with OBE, which she received very recently, and that is for her services to critical care nationally and internationally, especially during the COVID period. It's a real pleasure to have you here, Alison, and I would like to hear, or we would like to hear, what do you think?
Thank you, Ravi. And it is my great pleasure to be here to help celebrate the launch of Apollo's Centre for Excellence. What I've heard so far and from what you have told me, Ravi, it's an incredible thing to be doing. And I think the pandemic has given us the opportunity to reflect on how we deliver all healthcare, but specifically critical care. There are inequities around the world, and we know that there are health inequalities, and we're all trying to address that in various ways. But we need to ensure that there is equity of access to healthcare services around our own countries and globally as well. And I think one of the things we need to make sure is that we get the basics right. And the pandemic has showed us that when we first started almost 2 years ago with COVID, we didn't know what we were dealing with. So we weren't able to deliver any specific treatments. So we had to get the basics right. And I think Apollo's approach, the hub and spoke model, is where we need to get, because we can upskill people, we can train people with the basic skills to be able to roll out the delivery of care on a widespread level, so that everybody has access to what they need, when they need it, and where they need it the most, so they can be close to home, as we've already heard, because of the economical consequences of people having to travel to get the healthcare. The telemedicine that we've just seen is one of the things that I would really like to do in the UK. And I think that's where global partnerships come in. Developing, as you've said, for the Apollo work, having protocols and guidelines and standard operating procedures. Certainly in the UK, we already have many of those established. And I think working together as a team, not just clinically on the shop floor, but behind the scenes as well, developing the strategy. And anything that the faculty can do to help Apollo, we would be more than welcome to share our knowledge, share our resources, because there's no point trying to recreate things if there's already something there that is fit for purpose. It'd be great to be able to share what we have with you. And I would be very, very interested in looking at your telemedicine, because one of the things we've found in the UK is trying to get specialist intensive care input into our smaller hospitals, which in comparison to some of the remote Indian hospitals are big, but we can't get trained intensivists into our smaller hospitals. And I think having the basic critical care or even enhanced care input into those smaller hospitals and then providing the specialist input remotely is the way forward. And that is one of the things that the pandemic has given us the opportunity, is to reflect on how we deliver our critical care services. And we know that we need more staff, but do we need more of the same? And I don't think we do. Certainly in the UK, we have delivered healthcare in the same way since the NHS was established in 1948. And I think now the time is ripe for change. So I look forward to our collaboration going forward. I wish Apollo the best of luck, and certainly with Professor Mahajan steering you along the way, I think your future looks bright. And thank you for inviting me, Ravi.
Thank you very much, Alison, for those supporting comments, but also where we can collaborate. And I think that is what we will be looking forward to. So don't be surprised if this follows with chains of emails and email discussions as to how we take things forward. Same for Mike. So thank you, Alison. Thank you, Mike, for being here and for supporting us. And now is the time to invite our chairman to formally announce the launch of the center. But before I do that, just few lines or few seconds, I would like to reflect on Chairman's achievements. And it's no news to all of us who belong to Apollo family, but I think for our international invitees and also those who probably are not all that familiar, it may be something worth saying. So Chairman decided, after having practiced in the US as a cardiologist, to come to India to make sure that Indian healthcare system could be brought up to scratch, up to the international standards, so that the high-class international level of care was available to every man and woman in India. And that's a very ambitious but very noble mission. And I think what I've seen of Chairman in the last few months, he's tirelessly pursuing that even today. And Chairman, it will be fair to say that today's launch aligns very much with that mission in the area of critical care. I salute to you, Chairman, for such a brilliant and such a vision at the time when Indian healthcare system wasn't really performing very well. And that was about in early 80s, if I can remember. I think it'll be fair to say that you are the architect of the modern healthcare system in India. There are many people who followed your and you've been role model for them, who followed the same path and are providing very good service to people in India and beyond. Chairman, with that introduction, may I please invite you to formally launch the center. Thank you.
Namaskar and my greetings to all the honorable members who are here. Professor Mahajan, who has just been the recent president of the Royal College of Anesthetists, and Preeta, Dr. Hari Prasad, Sainath, Sunita Reddy, Professor Michael Stewart, Dr. Alison Pitrat, Professor Narasimhan, Dr. Kalpalata, all of you, I thank you, because this is a very important day, another milestone, I think, in healthcare, as we take emergencies or the critical care units to all parts of the country and the world. This is my intention. In healthcare, one of the most difficult areas is the critical care, where multi-speciality and the digital health plus the automation, all of these play a very significant role. When we can bring all this together and make a difference to a person in giving the family back to him alive, or sometimes, a gentleman who had no other hope, and you gave him that hope to come back to life. It's a wonderful thing. And this is what I think we can do. This is what, as a doctor and as a healthcare person, none of the healthcare services is just doctors alone. We are all one family. In Apollo, we have 110,000 plus families, which is growing almost continuously. But every single one has played a very single role to where we are. From 18 September 1983 till today, over 38 years ago, I think in almost all segments. But from day one, our vision was very simple, that we will give the very best possible care for the person who seeks and steps into a Apollo. And I think this is what we are saying. At that time, I said, who steps into Apollo? Now we say we'll step out to reach people, to reach people in other hospitals, to reach people in their homes or in their other healthcare facilities or retired homes, wherever they are. I think we have been doing this earlier. Sainath has clearly presented our international and the telemedicine centers that we have been running, several thousands of them, very satisfactory. Especially the ones in Himalayas, 14,000 feet high, have done a great job. And the words that is spoken from people there and the doctors there and the medical team there is very touching to our hearts. I think this is their emergency care is a multidisciplinary approach where we need several doctors together to be able to give the best possible advice for that critical patient at that time. The time is very important. This is where it makes a very significant impact. I'm very happy that we have put Dr. Hari Mahajan has put all this together, enlarged what we've already had, developed the telemedicine and the healthcare centers in Hyderabad and in Chennai and some other cities, now to all of our hospitals and to at least 100 other hospitals in the immediate future. But what I'm looking for is not our 70 Apollo hospitals or 7 other hospitals who are going to join this. I think we should be able to give this to the rest of the world. This is why I'm very happy that we have Mrs. Alison Pittard and Michael Stewart and Kalpata also spoke from US. I think all of these can give us that, added energy, enthusiasm. So we can give this so that people anywhere and everywhere in the world could get possibly the best possible healthcare at that most critical time in their life. So this is where I think I mark this as important as September 18th when the Honorable President of India launched Apollo Hospitals. Today, that was a 150-bed hospital. Today, we have about 11,000 beds. But that is not what the numbers is not counted in healthcare. It is what you have done, what you need to do, what more we can do to fill this huge gap in healthcare across the world. I think typically all of you have pointed out the COVID-19 exposed us to saying you have much more to do. And I'm happy that whether it's private or public healthcare, all of them join together to make a significant impact in managing the COVID patients across the world. I have deep appreciation of the great work that the teams have done. The doctors, the nurses, the supporting staff, and I say even my pharmacists who during lockdown went and delivered medicines at remote parts of the country, 1 mile, 1 hour, 2 hours away. I think all of them deserve this appreciation program. So this is where we get that energy back and say, what more can we do? Using digitization, using artificial intelligence, all these are happening. But something else is also happening. We never thought of COVID. In 100 years, we have ever seen anything like this pandemic. But it came. But I'm happy the world has managed it and continued to manage it. And we will come out of it. But that's not all. There's already a big warning for us. There is this non-communicable disease, which is going to be a huge crisis for the world, costing 80% of the deaths from NCDs, $40 million for the world. And then for India, it's going to be $4 trillion. Where can we get $4 trillion? Which is almost 50% of the GDP. This is where I think bringing our coordinated efforts, bringing others in the healthcare teams together. Preeta beautifully said, in my district hospital, the government hospital, which was 300 beds, we have now made it to the 800-bed hospital. The mortality in that hospital is comparable to anywhere in the world. That is because they have continuous access. And the so-called Red Book that is being published twice a week, that was followed rigorously. So every time I compliment them, said it's not our work. We just followed what is given in the Red Book. So I think this is where it can happen. I'm happy, Professor Mahajan, you have put all this together and rolling this out today, giving the country and the world a Apollo Center of Excellence in critical care. And I wish this will make a significant impact on improving the health of people and giving an access to the most critical care patient at his place. At his place can be anywhere in the world, and his place can be anywhere in the healthcare space. It's not necessarily an upper critical care. So this is where I think I compliment you in putting this together and getting all the technologies together. This is where I think the made use of the various technology, artificial especially, is going to make a significant impact in greater precision and digitalization. Will give that access. And I'm so thankful to the people who have served the world in critical care. And I now ask everyone in healthcare to say, let's all take another vow, saying, we will now work together to make a difference for people who need care at the most critical time. God bless all of you. I wish this venture my very best, and especially the international faculty saying, you are going to give us that extra spirit, saying, here you go. And no, there's no stopping on this. God bless. Thank you, President.
Thank you very much indeed, Chairman, for such warm words and so much encouragement, but also such a vast vision. So we've got tasks ahead of us to realize that vision, which is great. Thank you very much indeed, Chairman. We are coming to the close of our program. I will take a moment to thank Ms. Sangeeta Reddy, who is not here, but she's been the spirit behind the digital transformation of the Apollo network, but also behind EICU. And we have on our screen now the clinicians from various parts of the country. Pankaj, do you want to introduce them? Or do you want to say something?
I think we just want to kind of just let people just look at the image of people turning in from all over the country. Now, with the power of technology, we are literally 1,000 eyes and ears around India right now, and in fact, United Kingdom. And if we can do this with the power of our buttons, imagine what we can do if we put our heart and mind to curing illness around the world. And I think today is a great beginning, and I really appreciate this opportunity to be part of this.
And thank you all for joining us this morning. Brilliant. Thank you. So these were spread out all over the country. I think people from their intensive care units trying to connect with us. Thank you. And that brings me to ask Ms. Sunitha Reddy, the Managing Director of the Apollo Hospitals Enterprise, to give us, or give all of you a vote of thanks, but also few words of wisdom, Ms. Sunitha, as to how do we take it from here? How do we go forward? Thank you.
So, namaste. Good afternoon, everyone. And let me begin by thanking all of you, Chairman, for your vision. It was your vision that really guided this project. Sangeeta, for really putting it in place. Our Vice Chairman, Mrs. Preeta Reddy, for making sure that all the parts came together. And of course, Dr. Ravi Mahajan and Dr. Sai Harinath, you have really been at the forefront of making this a success. I would also like to thank our guests, our international guests who are here today, Dr. Alison Pittard and Dr. Kothart. And with this, the entire Apollo team. What I learned from this is that, while we've built this wonderful center of excellence, Apollo Hospital, and that was Chairman's vision, we were able to leverage the intellectual property we had with us. And I think Dr. Alison Gotthard referred to that. He said, when she said that, we didn't have to recreate the learning. We took what is best within us and we were able to leverage it. During this process, in an endeavor led by Dr. Sai Harinath and Dr. Ravi Mahajan, during the COVID crisis, we trained 130,000 medical practitioners in the use of ventilator. And I think, the importance of ICU can ever be underestimated. If we look at our country today, we have 94,000 ICU beds. and out of which 59,000 are in the private sector. But beyond that, as we look into the future, we recognize that more and more people will come into the hospital system, especially for ICU care, which is why it is extremely important that we think beyond just the Apollo patient, that this is Apollo's way of reaching out to society, to reaching out to patients wherever they are, to make sure that they come through this critical episode in a very successful way. And I believe we've done that. We've done that through our research. We've done that through the publication of our red books. And to all of those who were part of this, my gratitude, because you have really helped save lives. And I think going forward, if you look at what Yale University has done, which is really, they have established a telemedicine network. And this, of course, has saved many lives. If you look at what happened during COVID, where there was intense pressure on intensive care, we've now found a solution to look after patients beyond just those in our beds. And I think for this solution, I thank the entire team, because without your effort, without your commitment, we would not have been able to put this together. As I look forward, I would, I refer to the study that was made by the Indian Journal of Critical Care. And I think in that, it showed that the combined usage of technology, of trained doctors and nurses, and the knowledge, which is a critical part of it, really improved mortality rates. And what more can we ask for? What more can we ask for but a healthy patient who survives the worst of times and comes out of it with a smile. So my deepest gratitude for all of you who've been part of that process. And as Apollo, we've gone beyond thinking of only our one hospital in Greens Road. And let me be very selfish here. When I heard Dr. Mahajan was here, had joined the team, and Dr. Sai Hadinath, I said, I really want them here. I want them to be in the Apollo system first, and then we can share them with the rest of the community. But I think Chairman and Sangeeta were very firm. They said, no, we need to share. We need to share our intellectual resources. We need to share our doctors, and we need to provide the best clinical outcomes, not just for Apollo patients, but patients beyond our system. Finally, I look at the name ACECC. So ACE for us is all about Apollo Clinical Excellence. And Apollo Clinical Excellence getting magnified with Apollo, with critical care, I think is something that will change the lives of many. So I wish you all the very best. I know that you have a great opportunity in front of you. And, like Winston Churchill said, never let a crisis go to waste. I think you've really converted that crisis into a wonderful opportunity to save lives. And my deepest gratitude to all of you who have done so. May God bless you to continue the wonderful work that you're doing. Thank you.
Thank you, Ms. Sunitha, for such kind words and thinking of going forward. And you're absolutely right. So thank you indeed for that direction. And that, ladies and gentlemen, brings us to another phase of our program. And I will invite Sam to take us through that phase. Sam, please.
Thank you, Professor Mahajan. I believe most of the questions have been addressed on the chat, but we want to leave some room for any fresh questions from our media folks who have joined today. Okay, I'll probably speak on their behalf on 2 or 3 questions which has been posted on the chat. Quickly, I think there are 4 or 5. I'll club it. One is, where will these e-ICUs be available in remote locations? And the cost cost to patient of eICUs against regular eICUs? So what will be the cost difference? And I think there is another question around the staff on ground selection process.
Sam, I think it's been, this has been answered on the chat, but I'll repeat that for you. There is no restriction in terms of a location because of the technology. We can have an eICU in any location. As Chairman said, we have it up in the Himalayas where it is difficult to actually reach the place. So when we could have it there, we could have it at any place. But the focus is really on places where critical care as a entity is non-existent, but much required by that local population. So that's going to be the, there's no restriction in going to any place in the country for this program. In regards to the cost, it's already on the chat. The cost is going to be much lower because the patient is remaining in the hospital at the periphery. The medical cost will be much lower. And second thing would be, as Sai said when he was speaking, the cost of traveling and relocating to another city or and also losing their daily earning from because they have happened to be away from their home will also be saved. So overall put together, the cost of managing a patient on the eICU in a remote location would be significantly lower than actually a patient traveling to a large hospital to get trained. And the third part of it was in regards to training of the staff. As you already heard, more than 150,000 staff were actually trained on the use of ventilators, even as the pandemic was on. Now, as a part of this program, first thing that would be done is all the hospitals that enroll, all the facilities that enroll for this program, they would be first trained on how to use this platform for the benefit of their patients. That would be the first step of the training for the local staff. Then the next step would be to upskill their capabilities, their expertise, their skill sets, so that they could start gradually doing more and more for the patient at the same remote location, to an extent where someday they will become self-sufficient. So that's about the training part of it. Dr. Agarwal, Dr. Ravi and Sai, we want to add, please add on.
I think, Dr. Hariprasad, you've covered everything. I think the one thing to say is that what is really important at remote location is for people to recognize the sick early so that they can get in touch with the hubs unit early on, because quicker you recognize illness and illness becoming critical, quicker you get the advice, better it is for the patient, and patient is more likely to remain on your location. So one of our training objectives will be, as Dr. Hariprasad said, to upskill people to recognize when the illness is becoming critical illness, so that they can refer their patient or get access to us fairly quickly and get the right advice, so that patient is stopped from becoming so critical that they have to be transferred. So it's the skill set right from the training to the ventilators, to recognizing the critically ill, but also managing some basic skills if patient is at that level of sickness. So those are the components that we put together as part of our multidisciplinary program. It's not only directed at doctors, but also at nurses, but other paramedical healthcare workers who would be the part of the intensive care unit. Sai, I'm sure if you want to add anything to that.
Sure. Thank you, Dr. Mahajan, Dr. Hariprasad. I think honestly, good critical care is not expensive. It actually involves looking at the patient all the time continuously, and having a remote command center allows you to make sure that things which work, we know very well that there are some things which work for patients. For example, keeping the head of the bed elevated prevents pneumonia. On a ventilator, you need to have very particular settings in COVID ARDS, for example. Also watching the glucose, preventing blood clots. All of these things don't cost anything, but you need to do it all the time. The analogy often given is that of aviation. When you're flying a plane, you have to check 1,000 parameters all the time to do it safely. So when you're flying a plane now, you don't know who the pilot is. You don't know who loaded your luggage. You're not even sure who the air traffic controller is. but almost always we take off and land safely. Healthcare and critical care is like that. And this can be done with the use of a remote command center. And doesn't matter where the patient is, we can actually monitor them all the time. When you're at the bedside, you're often distracted by many other things going on. Because we're in a command center right now, we're able to very systematically look at every patient, look at all their parameters, and give advice to the remote team. And that, I think, is a power of technology, along with the ability to actually do things in a systematic way. Now, this would not happen without the support of a big team. Nurses form a critical part of this, and our mission is to continue to educate and upskill our nurses. In addition, we need managers like Pankaj here, for example, who's been helping us for several years now in making this run. In addition, we need technologists who can help us keep the systems going. And all of this, of course, needs electricity. So these are all the different components which are involved, but ultimately it's about the desire to help a person on the remote side that really costs nothing. And the ability to connect with them is what Apollo does really well.
And I just want to add on here, both Dr. Ravi, Sai, and a huge army of intensivists across the Apollo system. What they've done is tremendous. As Dr. Ravi Mahajan said, it is more important to identify a patient who is going to become ill before he becomes really ill. So they have actually analyzed the entire data, put it into machine learning, and created an artificial intelligence tool which actually predicts a possibility of a patient turning bad or becoming critical. Using this tool, I think a lot of patients would benefit from treatment before they become ill, and thereby, apart from saving lives, it also saves them a lot of financial burden that they would have incurred if they had become ill.
Thank you, Professor, Dr. Sai, Dr. Mahajan. And I think one last question, because most of them have been answered already. What are the plans for Apollo Center of Excellence in Critical Care 1 year from now, both in terms of patients covered and in terms of new skills added?
Again, I think I answered this on the chat. Right now, we have one hub in Hyderabad, which has been operational, which is the pilot hub, which has about 500 beds. And then in the next week, Dr. Ravi Mahajan is operationalizing 2 more hubs, one in Chennai and one in Madurai. With that, another 500 beds will come into the thing, so it'll become 1,000 bedded. And then there were now plans to expand it into Delhi, Bombay, Ahmedabad, and other locations, Bangalore. And the aim is to have 10,000 beds on the system, on the EICU platform within a year's time.
Thank you, Doctor. I think that will be all from our media folks. And any last words from any one of you before we close the session?
All yours, Dr. Ravi.
Well, first of all, thank you all, and thank you, Chairman. Thank you, Ms. Sunitha, Ms. Preetha, and Ms. Sangeeta in her absence. Dr. Hari Prasad, for being such a support, and thank you, the team, for putting it all together. Dr. Nandini Ali's team, Saurabh, Mayank, I can't even name, so many people have been involved in all this mega. People have been working till last minute, last night. The website has been launched, and so you're more than welcome to go on the website and see all the things, all the questions that you have would be answered there. But if there are further questions, please get in touch. The launch doesn't mean that we begin and finish here. This is just the beginning of the journey, and we're all in it together. So media, the government officials, us, the international collaborators, everybody is in it. So let's all work together towards that. I will invite Chairman, since Chairman, you're here, for the final word, and then we can close the session. Thank you very much.
I'm very pleased today because, as I said, this is another important day. COVID has taught us the need for expertise in the critical care area and what significant impact it can have on people. And very nicely, Sai has shown what they're not doing outside Apollo. So I think what we need is, as I mentioned, the most critical part of healthcare is in the emergency care, in the critical care units. So here we need to see how we can coordinate, how we can digitize, how can we bring the artificial intelligence to give the expertise to the patient who first we should expand access to people. That is our first aim, is to give access to a number of other people, maybe 10,000 now, maybe 100,000 later, but it's unlimited access because the need is so much there. So I think our aim is, we've started now, we want to give the expertise at remote areas. And this is where I think the satisfaction will come, saying in healthcare, we all need to work together towards that goal of sharing our expertise and giving our very best to that person who needs it at their most critical. I thank all of you and appreciate the efforts put by Professor Mahajan and the whole team. And Hari was very positive of what we've done and what we will do. God bless all of you.
Thank you, Dr. Thank you, Chairman. Thank you, Ms. Preeta Reddy. Thank you, Ms. Sunita Reddy. Thank you, Professor, Dr. Hari, Dr. Sai, and thank you, media folks, for joining us today.